So happy anniversary.
Coming up in 2 days.
I know. How many years?
29.
29 years. Oh my gosh. Well, happy anniversary. I'm Irene de Jesus.
And I'm Hector de Jesus.
And we are the de Jesus Law Group. And this is the noon show.
Because it's noon somewhere in the world.
Yes. And so will you do the disclaimer?
Yes, we are attorneys. However, we're not necessarily your attorneys, but that can be remedied. All you have to do is call. And this is informational and educational purposes only.
Almost got you stuck on that one, right? Yeah. All right. So it's Friday. And it's 2 days away from our anniversary. So that's pretty cool. 29 years. Do we have plans? I think we're going to have to make some plans. Mm-hmm. Yeah, we need to get some plans put in motion. But other than that, I don't know about you, but I had a blast on Tuesday night. We did our Wine and Wills, very first in-person event in 12 months.
Yep.
12 full solid months. And got to do that in person. It was at Dr. Ariel and Dr. Wes's place. There are chiropractors in New Smyrna Beach, and it was so much fun educating the community. Really a Wills 101, right? Mm-hmm. Explaining everything. That was a blast. And then we had Val there with Scout and Cellar, and there was wine tasting after. That was a lot of fun too. I don't drink, but it was fun smelling what did she call it? A bouquet or the aroma or whatever. I learned a ton. So that was a lot of fun. Speaking of which,
we have another one coming up.
We are. We're going to do it again. This time we're going to do it in DeLand. Mm-hmm. And we're going to do it at one of our financial planners' offices. Rebecca Jones. She is amazing. Wonderful, wonderful lady here in DeLand.
RLJ Wealth.
Yes. What's it called?
RLJ Wealth.
Yes. So she's going to be hosting the Wine and Wills.
At the Proctor
at the Proctor
House.
The Proctor House, yeah. That's on New York Avenue, right?
New York Avenue.
Yep. Mm-hmm. And so Scout and Cellar will be there as well. So we'll do a wine tasting event right after. So that should be really good.
March 31st, Wednesday.
You'll need to
8:30.
You'll need to RSVP for it. So there is limited seating, right? We're making sure that we're following all the guidelines and that we're being responsible as we're social distancing. But it is so much fun to do this in person again. So if you are interested in Wine and Wills, Win, our producer, she will have the link in the comment box. So sign up for that because seating is limited. And as well, today's show is all about health insurance. So we're going to have a special guest on to talk just about that. If you've got any questions about health insurance, because there's a lot going on right now. If you've got any questions about it, get into the chat box. Put some questions in those comment box, and our guests will be able to answer those for you. If you've got any questions for us, legal, let us know, and we'll be able to get to those questions as well. So, what are we talking about this week?
We're talking about health insurance.
Yes, health insurance. And we have a special guest. Her name is Kim Reines. Really cool lady. And she's going to talk to us about all the changes that have been going on in the laws lately. There's a bunch of changes going on with the Affordable Care Act. And she's going to walk us through those changes and how those could impact you as a family.
Yeah, and extensions on when you can apply and stuff.
Right, or as a business, how all of this. So we're pretty interested in that business part of the piece of it. And so Kim's an insurance broker. She's been doing this for over 12 years. She's doing this many years. She's a district manager. She's licensed in over 12 states. She also can talk to you about business, health insurance, life, vision, dental, all that great stuff. So do you want to bring her on?
Hey,
Kim, how are you?
Great. Happy Friday.
Happy Friday. Yay, Friday. So, Kim, there has been so much going on in the news about changes to healthcare and healthcare insurance. Can you start to fill us in a little bit on what's been happening?
I believe what you're talking about is the Affordable Care Act, and there has been changes in that. They have a special enrollment period going on right now. You haven't missed it. It's still happening. It's from February 15th through May 15th, which is a 3 months, which normally it's only a month and a half. It has been for the last few years. So you have an extra time.
Oh, wait a minute. So wait a minute. So why do we have extra time to
Because
enroll?
Biden administration came in and they decided to open it back up. And they also raised the tax credit, the subsidy, what you can get a subsidy for. Last year, as a single person, the max credit was $40,000, and it has raised up to $51,000. As an individual, you can still get a subsidy. Not 100% subsidy, but you would still get a subsidy. 100%.
Okay.
Go ahead.
So listen, I know you know this stuff inside and out, okay?
Right.
Most people don't. So
Right.
when you say a credit up to 51,000, does that mean it's your income? What does that mean?
Your income, yes. You as a single person, if you make 51,000 or less, you will be able to get a tax credit for your health insurance.
Wow.
Paid by the government. So just depending on what your particular situation is, it could help you if your income happens to be lower this year, but they did raise it. So more people are going to get the subsidy this year just to help with that tax credit.
Now, what if you're married? What is the tax credit now?
It's now for two people, it is 68,000.
Okay. So kind of penalized if you're married, sounds like, when this is our anniversary weekend too.
I know. Well, you are
Okay.
where you're most likely not going to get a subsidy, but there's good and bad with that. But
Got it. What about if you have kids? Does it affect anything?
It does. It goes up to your family income. Family of 5 is up to 122,000. So that's a family of 5.
Okay, good. So children then, where you'd likely really need this health insurance, if you've got children, it sounds like it's a higher threshold.
So how does someone enroll in this now?
Yeah. What do they do, Kim?
They could give me a call. I'd be happy to look over their options. They can also go on healthcare.gov and see if they want, if they're like to do it themselves, and just take a look at the options out there. It's pretty simple questions. They ask you just, basic, how many people in your household, how much you make, current prescriptions, doctors, if you need them in your plan, and then it sort of gives you your options from there. If someone wanted to do it themselves, or they're welcome to call me because I can definitely help them out. And if there's a lot of options out there, honestly.
Yeah, there is.
Through. I just say it so easily, but it is confusing for people, and I am happy to look at everybody's options for them.
Wonderful. And I know when she'll have all of your contact information in the comment box. So if anybody's got, they want to get a hold of you, they'll be able to do it that way. So that's good.
Yeah. So how does this new open enrollment period help families or businesses?
Yes.
If you qualify for a subsidy, it will help you get your insurance if you haven't already gotten it last year. But it also gives people, brings it back to the state of mind to look into their insurance, because there's other plans out there for people. The Affordable Care Act isn't the only plan. There's private insurance for self-employed, small businesses that could actually work out to be a little less expensive if you're not getting a subsidy, or if you just have different health needs. Everybody's health needs are a little bit different. So that's why, it's important to have a broker or just somebody that can help you navigate through what's going on.
So, Kim, you said the word that you said broker, that you're a broker. What does that mean?
A broker means that I am a local and licensed agent to sell for all the major carriers. So I don't work for just Blue Cross and Blue Shield. I work for all the major carriers. I work for the ACA, which is the Affordable Care Act that we talked about, as well as the private companies such as United Healthcare, Aetna, Humana, Blue Cross, pretty much I have access to about 150 carriers. We don't have enough time for that, but all the major carriers I can help you with, whether you're an infant and you're just getting, added to the plan, or if you're over 65 and need to look into your Medicare, I also help with that. So,
good to know. Okay, good to know. And then can you talk a little bit more about businesses and health insurance? I imagine you have to be a certain size business with a number of employees to be able to take advantage of that.
Actually, you could be a business of one. Normally, people don't do that because it doesn't work out financially, but it just sort of depends. But you could be as small as 1-2 people, or you could be as large as hundreds of people. The small groups are the ones that are probably struggling to get benefits or don't think they can. But there's a lot of different packages available. Just depending on the dynamic or demographic of that group. But there are a lot of options that are actually very affordable. And you could just do a simple payroll deduction. And I could help them set that up as a list bill. Or something.
That's nice. Yeah, that's good to know. Great.
And it's pre-tax, just like a regular, group insurance. So it has a tax benefit as well. But there are a lot of options. A lot of people don't think about it, but I think it has become more top of mind with the COVID and the Corona and the state that we're in currently. People just want to make sure that, all the I's are dotted and the T's are crossed and they're, healthy.
And so, that brings up a question, and I don't know if you know the answer or not to this. So if you don't, it's okay. If you did contract COVID, do the insurances by and large cover that? The health insurances cover that or no?
Yes.
Ooh.
Yes.
Okay.
Most of them all do the COVID screenings and tests. And yes, all of it is normally covered under most major plans.
Okay. Well, that's good to know because I didn't know with that being the case. Anything else you think we should know about Kim as we're in this open enrollments time frame? And there's so many changes that have gone on.
Right. If you don't like your insurance, you're not sure about your plan, you think it's too much. A lot of people have group plans that they're a spouse or a dependent, and it's very expensive to add that spouse and dependent. And I can help them with that as well, save them money. I've helped people save 40 to 50% just looking into private options versus, because a lot of people don't know if you're offered an employer plan, whether or not you can afford that plan, you are not eligible for any subsidy. So you will have to pay top dollar, which means more than you probably can afford on the marketplace or the ACA. I know those are, I don't try not to get too many terms, but so there's a lot of options out there for people. So that is one thing that people should maybe reach out to me, because I've had a lot of people that their plans are a lot more expensive. It used to be very inexpensive to add a spouse or child, and now it's very expensive. So I can help them with that. There's just so
Kim, does that mean then the person that's employed by the company that's getting the health insurance just as part of their employment, they keep that insurance, but then the spouse and the kids, you put them on a separate plan?
Correct. Yes.
And it's more cost effective to do it that way?
Much more. If it's a healthy young family, yes.
Yes. And that's good to hear, because I think the conventional way of thinking is you go to a company, you get on a plan, and you put your family on a plan, and that is expensive.
I've been saving people left and right with that, because they just don't know. And then you get one person finds out, and then it's like, it snowballs because they tell their coworkers, and, a lot of, same like groups work together, families,
Mm.
small families, new families, so yeah, it's always a good time to review your insurance, just like your life insurance, your health insurance, auto, any of it. Look at it at least, every 6 months, see what else is out there. There's always ever changing plans. And it doesn't normally cost anything to change from one to the other. The only time that there's an issue is if you are locked into an employer plan. Sometimes you can't get out of that plan until their open enrollment. But normally, as an individual, you can change at any time with any insurance.
And do you typically have to go through, like with life insurance, you've got to go through like all the blood work and all the testing and everything. Do you have to do the same thing for health insurance?
No.
Ooh.
No, those are normally just simple couple questions. They'll run a quick background check for the private. As far as the ACA plans, they cover everybody. So there's nothing to get approved for, but to get approved for the private plans, they just do a quick screening of your MIB. Just take a quick look at that and your prescriptions and make sure there's nothing major on there. And it's within 48 hours, if you're approved or not. Normally almost.
Excellent.
Yeah. So there's no big long wait. There's no paramed. You don't have to go to the doctor, do all that.
So one of our really good friends, she had told us that she had worked with you, and prior to that, she had gotten a quote for her and her husband. It was going to be like $1,100 a month. And really, that was not in the budget. It just wasn't in the budget. And so, what was suffering for her was her yearly medical checkups. When you get to a certain age, those are pretty darn important.
Right.
Yeah. And then she ended up working with you, and you were able to get her really good health insurance with her local physician. And it was like under $400 a month. It was really affordable.
Yeah, I think that's Annie. I saved her a lot, like 70% from the quote that she had prior to that. And it's just a matter of being able to look at everything, because I tell people all the time that, you could be the same. You could have a twin sister and your insurance is not going to be the same. It just really is. Over 65, maybe, but under 65, there's just so many different choices. There's just so many different choices.
And that's the reason to work with Kim. Yeah. Yeah.
Your health, your income, your family demographic, it all, there's a lot of different things to, because people are like, well, my so-and-so is only paying this. Well, so-and-so might only make, $15,000 a year, unfortunately.
Right.
And you're not, so, you don't really want to, make people feel bad for making less money. That is what it is, but that's why we have the Affordable Care Act for people that are making less money, so that they can also be healthy, because it's really important to be healthy. Honestly, I'm very passionate about people being healthy and being covered, because it's no big deal to cover your car, cover your house, but cover yourself, because that you cost more than anybody. And if you're not here, what does the rest of that stuff even matter, right? So
good point. Body wears out, okay, but when your body wears out, right. You need to take care of that.
On your preventative things are just make a huge difference. It really does.
Kim, thank you so much for being here. Really appreciate you taking time out to really talk about this subject. The open enrollment, you said, goes till when again?
May 15th. So you have some time, almost 2 more months. So yes.
Okay. Excellent. Thank you so much, Kim.
Bye. Have a great weekend.
You too. Bye-bye. All right. That was really good information.
Yeah, real good information.
Yeah. And I hadn't realized that open enrollment was extended. So that's a really big help. I think the other thing that's very helpful is you don't have to go through all of these tests in order to become eligible.
Right.
So it kind of takes away one of the barriers, right, to put it in place. And what could it hurt to just check out to see what could your rates be, So you can take care of your body. You can take care of yourself because you have one body, right? And your health, make your health a priority. Yeah. So on that note, we'll end the show. What else we got going on? Anything we want to end with?
Nope. Just the One Wills, Wednesday the 31st, 6:30 to 8:30.
That's on the 31st. Yep. Make
Mhm.
sure you register for that.
Yep, and our next noon show will be our 4 years birthday special next
Oh,
week.
that's right. Next week is going to be a special noon show because not only will we have hit 29 years married, we will have hit a special milestone in our law firm.
Mhm.
As we started to practice law differently,
Yeah.
right? Because we've had a law firm since when? 2006? Yeah, and then we had our own life event, and it changed the way we practice law. So that's a really special anniversary to us coming up. It's going to be 4 years, right? 4 years. That is so cool. We got a lot of celebrating to do. This month is Caregiver Month, right?
Mm-hmm.
And what's the special that you get?
So if you book a family wealth planning session, that's a 2-hour meeting. And what is that, Irene?
Oh, you're asking me this time. Look at you turning the tables. So a 2-hour family wealth planning session. It is, I think, the coolest thing ever. You're going to do a little bit of homework prior to us meeting so that I can review it. And we're going to sit together for 2 hours. We do all of these virtual. We do them on Zoom. Even though we have 2 offices, right? We've got one in DeLand and one in New Smyrna Beach. We're still doing everything virtual until, all the vaccines, if you want to take them. All of that gets out and all the restrictions have eased. So right now, we're still virtual, but it's a 2-hour session. You'll do a little bit of homework. And then I'm going to walk with you, or Hector, depending on who you want to book it with. We're going to walk through with you what are your goals? What is it you want to achieve? And what would happen if something happened to you? What's going to happen to your family based on your family dynamics, your family structure? What will happen to your assets? What do the tax laws look like? What does it look like right now with the plan that you currently have in place? Is it going to work the way you want it to work? And we do all of that at no charge if you do your homework. Otherwise, it's a $750 cost because you get me for 2 full hours or you get Hector for 2 full hours and we walk you through everything. So if you would like that session at no charge with no obligation, just do a little bit of homework, right? And the way you book it is when I'm sure has already got a link in there in the chat box for that. You just go to our website, click on the calendar, pick appointment with us, and and then the rest is pretty simple and pretty easy. So we walk you through that process. Did I answer that one okay?
Yes.
Should I have added anything else?
No.
Did I miss anything? No, I did good. All right. So with that, you guys, we're about to go get ready for our long weekend with our anniversary coming up. I hope you have the opportunity with your loved ones to have some rest and relaxation time this weekend, unless you're like us when we were nurses and you're working on the weekend. So if you're working this weekend, the weather's going to be a little chilly anyway, right?
Yeah, it's chilly for some reason.
Yeah. Either way, enjoy your weekend. Great being here. We'll see you next week. Same time, same bat channel for our big celebration.
Go Cubs.
Go Titans.